everyone see me? Raise your hand if you do. If you could put your phones on mute, that would be great. And if you have questions, please feel free to ask, interrupt, and tell your stories. This is very, very important simply because dental health is the key to mental health, digestive health, physical health, and emotional health. And so we're going to start with really practical things. And we'll go into the reasons why some of these things are recommended, why some of these things are important to think about in your life. And I was thinking about this, why teeth? Why are people concerned with teeth? Why do you want to go to dentists? Why do you want to take care of your teeth? And I think the main purpose here is you want to keep your teeth for 100 good years. Is there other reasons why people want to take care of their teeth that you can think of? Tell me.
To be able to eat good food.
Yes, to be able to eat good food that you taste with your own mouth and tongue and teeth, and keep those teeth grinding away for several decades of your life. So it's very important to think about dental health because people tend to think of teeth as not quite alive. They tend to think of teeth as not quite human. They think of the teeth as they would of their iPhone. You can bathe your iPhone in ethyl alcohol. You can wipe it down with alcohol and bleach and all, and it gets shiny. But guys, this is an object, and your teeth are a live part of your body. So it's very important to think of your teeth as a live being, number one. And with regards to seeing a dentist, let me tell you my own story. My mother, fortunately or unfortunately, did not know that there were such things as dentists growing up, so I never saw one. Never saw a dentist growing up, never had a cavity that I had to fill, and I ate pretty standard traditional Indian fare. I had one cavity with each pregnancy or so, my dentist told me when I came here, and 2 cavities, one of which was filled with amalgam. And so my third dental appointment was about 4 or 5 years ago to remove that amalgam from my mouth. So I've been to the dentist all of 3 times, and a couple of times because I got this postcard from the dentist to say, you must come, you must come. You haven't come, you haven't got your teeth cleaned, your teeth are gonna rot, you know. So I went a couple of times and then never again. So my experience with dentists is very minimal. Never had orthodontics, and I'm here to say that that is the way to good health. The best dentist is the one you're never gonna see. Why do people hate dental exams? Anyone take a guess?
I guess the idea of pain associated with anything the dentist supposedly can do to help you.
Yeah, there's pain associated with it. There's a very natural and intuitive fear of having chemicals put into our teeth, into our mouth, of having our teeth drilled, of having fake enamels and porcelain and lead and steel posts and cadavers of dead animals put into our mouth. Our body recoils at the thought of a visit to the dentist. My favorite mystery writer, Agatha Christie, wrote, "No, my friend, I'm not drunk." This is the investigator. Hercule Poirot says, "No, my friend, I'm not drunk. I've just been to the dentist and need not return for another 6 months. Is it not the most beautiful thought?" And the reason for that is it was painful, it is painful, and it is devastating for your health to go to a dentist. So right off the bat, assume this to be permission. I give you permission. The Lord, nature gives you permission to never see a dentist if you don't have a problem. You don't need to get your teeth cleaned every 3-4 months or every 6 months. You don't need a dental exam. Why? Because that's exactly what your dentist wants. Every cavity is a $7,000 annuity stream for a dentist. Anytime you have a cavity, the dentist drills around the cavity and expands it. Then they add amalgam to the cavity, which creates a host of problems in your body. Then that amalgam drops out after a few years, so you grind it out. Then it's time to refill it. Oh, but the cavity is increased in size, so it must be drilled further. Pretty soon, it's a cavity that's deep down to your pulp chamber, and then it's a root canal. Pretty soon, the root canal fails, then it's an implant, and there's nothing after an implant, because by then you have autoimmune disease, folks. You have infections, you have autoimmune disease, you've spent $10,000 to $15,000 on that one little cavity, and you've not enjoyed good health. Who are you making rich? The dentist is making, adding sections to his house, making that pool extension, and the marketing is set up to scare the living daylights out of you if you don't return to this painful visit, every 6 months or even more frequently. So the key to remember is that you are in charge of your own health, not the dentist, not anybody else. You are in charge of your own health the same way you're in charge of your body. So don't be scared of managing your own teeth yourself. What do dentists do? They do root canals. This is a crime, in my view, that happens far away from the scene of the crime. Because what you're doing in a root canal is it's a dead tooth. You're taking out the living matter in the tooth, pretending it's an iPhone, pretending it's a piece of plastic, and you're drilling a post into it to just hook it to your gum as if it was inanimate matter. So what you're doing is you're taking a dead tooth and you're sticking a post into that dead tooth, and you're pretending that you have a tooth. Actually, you don't have a tooth. And what's happening is the damage from that process is causing carnage far away from the seat of the crime, from the scene of the crime. And what that's doing is it's making revenue streams for a cardiologist, your orthopedic surgeon, your hepatologist, your internist, as you suffer a host of ailments that you cannot find a good reason for. And can anyone guess why that happens? 3 guesses. Why would a root canal cause health problems in remote parts of your body?
Because of the bacteria are entering your bloodstream, and also the energy flows being disrupted.
Absolutely.
It's a foreign object that your body doesn't want there.
Yes, absolutely. 3, you hit it spot on. You're creating autoimmunity. You now have a foreign object that the body is fighting to push out. Every time you bite down, your mouth is filled with bacteria that are meant to be in your mouth, not in your bloodstream. Every time you bite down, stuff is going directly into your circulatory system. You don't have an immune system in your teeth anymore, in your root canal teeth anymore. So there is no white blood cells. There is no management of the sepsis that is occurring at that site. And you're getting infections far, far away that you cannot figure out the root cause of. You're eating clean, you're living clean, you're not, you're exercising every day, so on and so forth, and nothing is happening to your health.
Now, Sushma,
Yep.
Isn't each tooth connected to a specific system in the body? So if you find out where that root canal, which tooth it is, you can see which might be affected the most.
Absolutely. Absolutely. And in the Chinese medicine system of medicine, there are these meridians which are sort of like electrical circuits. We are dynamic. We're powered by our vital force. The Chinese call it yin yang or qi. Indians call it prana. Homeopathy calls it the vital force. But we are not a bunch of chemicals. We're a bunch of dynamic, ever-moving currents of energy, and the teeth play a primary role in that. And we're finding that out now. And when you break that circuit, you're wrecking that dynamic flow of energy in your body. You're literally creating scar tissue. The fasciae are your electrical circuits. When you have an accident and you have scar tissue in your connective tissue, you find that you don't feel well. You've never been well since that accident when you hurt, some part of your body and there's scar tissue there. Same thing happens with the root canal. It's affecting your meridian system and it affects your health in innumerable ways. Great, great. You answered that question. So basically you're taking a dead tooth, knocking it into place and hoping for the best. And then the dentist sends you home. Infective endocarditis. Many people have infections in their heart valves right over there that they can't shake. So then now begins this process of going from your dentist to your heart specialist. The heart specialist goes, gee, you've got infection in your heart valves. You got to take antibiotics. So now you're taking antibiotics for the infection that is unstoppable and that's free flowing from your root canal into the rest of your body. And the antibiotics are wiping out the good bacteria that you have in your body. By the time you've got your gut bacteria wiped out, your skin bacteria wiped out, what happens when you've taken these antibacterials? You get fungal infections, you get more viral infections. Your immune system is 85% your gut bacteria. Your immune system gets wiped out and you get all these unpronounceable modern day diseases that no one knows the etiology of. They say, oh, doctors will tell you it's unknown cause, not your fault, or you have fibromyalgia, it's all in your head, take antidepressants. So a lot of this leads to mental and emotional symptoms. And you find that after a root canal, the person goes on this sort of downhill slide of problem after problem, after infection, after surgery, after more problems, all the way down to the worst problem you could have, which is mental disease and emotional disease. Your brain is the controller of the rest of your body's activities. And once that function is impaired, you don't even have the ability to think about what is right and wrong for you. That's infective endocarditis. You can get joint infections. So you have arthritis in your joints and it's caused by bacteria. So this is the crime, to reiterate, that happens very far away in a very remote location. And the dentist abdicates responsibility for the wreckage, for the damage that they have created. And what they're saying is that tooth, imagine the tooth like a gangrenous structure. I want you to think of gangrene. See that lady with gangrene in her neck? You cannot, or if you had gangrene in your arm, say, and if you hung on to that gangrenous arm, you didn't amputate it, can you guess what would happen to you?
Well, you wouldn't have an arm anymore.
If you amputated, you would not have an arm. But if you had the gangrenous arm stuck to your body, what would happen?
Gangrene would spread, I would imagine.
Yes, yes. You'd be dead in no time.
You know, live. Yeah.
Yes, yes, exactly. And so a tooth might look innocuous, but it is no different than a gangrenous limb that you're leaving in your body to fester and infect the rest of your body with great and almost guaranteed ill health. They're Japanese scientists who looked at the effect of root canals. Within 3 to 4 weeks, it starts infecting the surrounding tissues. Within 6 months, almost guaranteed, every root canal has far-ranging infections all over the body. Your immune system is constantly in a flare. It's constantly trying to fight itself. And people think you have autoimmunity. So what do doctors give you? They give you immune suppressants. But your immune system is really smart. It's trying to get this gangrenous substance out of your body, and it can't because it's stuck over there. It's forcibly stuck into your body. In the natural course of events, that tooth would fall out. You would not have a gangrenous tooth. That cavity would get cleaned out by your body. Not a nothing, no problem. And you'd get well. I talk to a lot of people, young women in particular, who have front teeth gone, side teeth gone, and accidents and such, and that is a tragedy because it affects your looks. Someone said, "How do I kiss my husband with 2 front teeth missing?" You can find flippers, you can find alternatives, but the alternative I would not pick is the one of putting in a root canal. And why is your dentist not going to tell you this? Money, money, money. A root canal is an easy annuity for a dentist because he knows you're guaranteeing this guy an income. After you've gone to all these other doctors. And guess what? You are going to utilize the healthcare system as it stands today because one thing led to another, led to another. So I would recommend getting out of this complex. Pay for health. Pay for health, not for disease. At the outset, go to a dentist. If you have a rotten tooth, try and remineralize it. Go to a dentist that can pull it out if you don't. Hello, someone had a question? I think someone has their, needs to mute their phone, guys. Okay. All right. So the key here is to look at your teeth as live beings. Teeth are very much attached to your body. Teeth might look like enamel, but they're very living tissue. And that's key. Think of your teeth as you think of your intestines. Think of your teeth as you think of your skin. Think of your teeth as you think of your eyes. Every part of this tooth is alive. There's the enamel that is supported from within and from without. The enamel is laid by your saliva on top of your teeth. The enamel from the inside, or the enamel and the dentin, is produced by your blood, your arterial and venous system, your cerebrospinal system, your lymphatic system, which is constantly nourishing your tooth. So your tooth is alive. So a little bit about tooth anatomy. Here's the gums, which is the soft tissue around your teeth that is very much alive. And when you floss, you're flossing in that crevice over there, and we'll go over why flossing is such a toxic thing to do to your teeth. Anyone have any questions on the structure of the teeth? The teeth have roots that go into your jaw. There is the vascular system that nourishes your teeth. And in this pink zone here, there are little canals called the canaliculi, and they're 3 miles long, folks. Each tooth has a 3-mile long canal system that is nourished by the lymphatic fluid in your pulp chamber here, in your cavity here. And when you have a root canal, basically you're pulling out the life force of the tooth. You're pulling out the pulp chamber, you're pulling out the nervous system, you're pulling out the arterial system and the venous system, and your tooth is dead. So you've now got an infected dead tooth in your mouth. And so the key here, not to dwell on those matters, but on matters that we can actually affect is, what can I eat for my teeth? And you want to eat foods that are good for your teeth. And we'll walk through that in a very short time. And know that the teeth are a window into your body. If you have bad dental hygiene, chances are you're going to get a lot of bodily disease. And it's a window into your body, it's a window into your soul, into your mind. The only medicine for your teeth is food. The only medicine, bar none. And that could be minerals, it could be fats, it is water-soluble and fat-soluble vitamins, it is collagen, the connective tissue that your tooth needs to keep those ligaments in place. It needs proteins to make the various parts. It needs minerals to lay down on top and make the enamel and the hard substance of your teeth. If I was you, I would avoid going to a dentist unless I wanted a diagnosis. It's very important in life to know how to use science. You observe, you analyze, you think about things scientifically, and you treat them holistically. We have enough science where we know in minute detail the condition of a tooth, what leads to what condition, how the tooth is structured, yep. Someone had a question? No question. The only thing we then carry on believing is if the dentists have the science down, they must know how to make it better. No, your body knows how to make your teeth better because they're a part of your body. So the less intervention you have with dentists, the better. The less flossings you do, the better. The less pick you do, the better. The less dental cleanings you do, the better. The less dental exams you do, the better. What happens is, again, the money. They're adept at scaring you. This is a marketing tactic. Oh, Sushma, tooth number 32 looks like the gum is receded, and they poke it with that little prod and it's bleeding and you don't have strong gums. You need surgery for your gums. No, the only thing that'll cure gum disease is, again, diet. So less intervention from the dentist is better. What is the best kind of dentist? Anyone take a chance? Anyone take a guess? What's a good dentist?
The one that will take out the mercury with all the specialized equipment so nobody gets harmed in the process, a holistic
Absolutely.
dentist.
Absolutely, that's a good dentist. What else is a good dentist?
One who advises you in the connection with your teeth and food and what might be missing, what not be too much of, and all that kind of stuff.
Yes, yes.
You are your best dentist.
Yes, yes, very much so. Very true, all true. The best dentist is the dentist you don't need. Because you want to keep your teeth for a good 100 years. Okay, a little bit of biochemistry of the mouth, the teeth. Your mouth is actually filled with billions and billions of bacteria, fungi, viruses, 6 billion bacteria, 700 species, 9 different phyla. And if you were to stack them, they're stacked 6 to 12 deep in a day-old biofilm. What you see here is a picture of dental biofilm on your tooth. Folks, that's not bad stuff. This is like a refugee camp or a house or an apartment building set up by your very good friends, the bacteria. These bacteria are dental oral bacteria in a good, healthy mouth. These perform amazing, wonderful functions. What they're not designed for is the inside of your body. These are designed for the inside of your oral cavity. So what happens when you poke it or when you do flossing? Can anyone guess what happens?
Where you disturb them, I guess you move them or erase them or modify them somehow.
Yes, you remove them, you disturb them, you erase them, and you do something even more terrible. What you're doing is you're creating wounds in your mouth every time you floss. Remember how you bleed when you floss and you rinse and you think it's all so good and good things are happening to your teeth? No, you're creating little wounds in your mouth. That sepsis is causing these bacteria to go into your mouth and actually infect your bloodstream. So you want to change your attitude towards bacteria, and that is why I brought, as Claudia did, my fermentalon. This is for my dogs. This is my dog's sauerkraut, and they get these enzymes in their food. They get bacteria that are very, very good for their oral hygiene, that'll make them smell wonderful and not be smelly little creatures, that'll make their skin smell wonderful, because ferments like this are rich in bacteria, they're rich in enzymes, they're rich in water-soluble vitamins, which are just amazing for your teeth. So this is a plug for ferments. But the key here is a dentist will try and get these bacteria out of your mouth. A dentist's attitude is the mouth is an aseptic environment. It's a sterile environment. That is science from 100 years ago. That is simply not true. Your mouth is filled with wonderful bacteria that you nurture and allow to thrive with the kinds of foods you eat. So these are the 10 cities that your bacteria have set up from a clean surface. So you've just brushed your teeth, you brush your teeth, and fortunately with the toothpaste that contained glycerin. What is glycerin doing to your teeth? Anyone take a guess?
it's affecting the bacteria some way, in a negative way, in a negative sense.
Absolutely. It's getting rid of the bacteria. The brushing is getting rid of the bacteria, but the glycerine coats your teeth. And it takes 30 rinses to get the glycerine out of your teeth. So no bacteria until then, and no mineralization of your teeth by the saliva until then, even. And so every time you brush your teeth with a toothpaste that contains soaps and lauryl sulfate and glycerine, you're causing you're not only doing something cosmetic that doesn't do anything, you're causing great damage to your teeth. If you're on the right diet, you're going to have minimal plaque. You're going to have good kind of plaque. You're going to have the good kind of bacteria. You're never going to need to brush your teeth. You're never going to get cavities. You'll have good oral hygiene and good oral health.
Sushma, I have a question.
Sure.
What is the first time I've heard anybody say anything of good plaque? Could you say a few words about that?
Yes, this is the good plaque. Phase one, so you cleaned your teeth, and then the bacteria come into your mouth from all the food you're eating, and they coat your teeth with a little bit of, their stuff, mucopolysaccharides, and they bind to the surface of your enamel. The bacteria in your teeth actually have enzymes. They bring about preliminary digestive function in your mouth. And so people who have IBS, people who have celiac, people who have Crohn's disease, people who cannot digest their foods, or who get stomach aches after they've eaten food, they would do well to remember that stage one of digestion happens in your mouth through your saliva, which is excreting the salivary enzymes, but also through these bacteria, which have amylases, proteases, and lipases. So they help themselves to some of your food, and they also help to break down your food. And so it's critical that you have these bacteria in place to welcome your food in and to have better health. Did that answer your question?
Not really. I guess I'm wanting to know what you're considering good plaque. If that.
Yes. Good plaque is the certain kinds of bacteria. What happens is, if you are on a low sugar, if you're on a goodly protein, highish fat diet, you have friendly bacteria, you have lactobacilli. In a sugar-laden laden diet, you're going to have more yeast that are fermenting the sugar. You're going to have bacteria that cause pyuria, or streptococcus mutans, which thrive in a sugary or acid type environment. So by the foods that you eat, you're encouraging good or bad bacteria.
Got it. Thank you.
Okay. And so what does dental cleaning do? What you're doing with dental cleanings is, number one, and you said all those things actually, you're causing sepsis, you're putting poisonous chemicals into your mouth, most of the time Listerine and this and that and other chemicals that you use to rinse your mouth out, or your dentist does that to rinse your mouth out. You're getting infections from the implements. You're using very harsh cleaners. You're taking away your biofilm, which is an essential part of good dental health. So I would skip any and all dental cleanings that involve pointed materials, chemicals, substances that you would not put on your skin. You would not scrape your skin with a pointed object, with a knife. You would not put, ethyl alcohol on your skin. Why would you put it in your mouth? So avoid dental cleanings.
Another question about that. In the past, when I've gone in for dental cleaning, I'm aware of the technician scraping my teeth because there seems to be some hard substance, I'm assuming she calls it plaque, to remove that. So it could be my diet or something else, which is causing the accumulation over the 6-month period for that to form on my teeth. And I think that would probably not be helpful.
Yes and no. If the plaque consists of good bacteria, good colonies of bacteria, it's not a bad thing. There was a dentist by the name of Destiny Price who went to Switzerland, where children were walking barefoot. They lived on raw milk and rye bread that had been fermented for 30, 40 days and continued to ferment after it was made even. They never brushed their teeth. Their teeth had green slime and all sorts of plaque on it on them, but they did not have a single cavity. So plaque does not equal cavity. Plaque does not equal ill health. That is a concept or a precept put forward by dentists, particularly, and very bad science that asks that you do this and that and the other to your teeth. Now, having said that, if there's bad plaque from years and years of eating, very farinaceous foods or foods very hot, rich in sugar, and if you have bad breath and so on, I would say that's an indicator of poor oral health. And the key to removing or blasting that plaque, I will come to very shortly. The very good natural techniques for that.
Great, thank you.
All right. And so we have this flossing. 100 years ago, there was no Johnson & Johnson dental floss available. People had beautiful teeth. People survived just fine, the healthy people, and lived to ripe old age with all their teeth intact. Today, we're telling our dogs and cats to be flossed as well. And try and floss a cat or a dog, and you will know what I mean about an animal knowing what is good for it and what is bad for it. Flossing is a barbaric act for either man or cat.
They actually need to give a cat or a dog a dose of some type of anesthetic to be able to do it.
Is that right?
Oh yeah, that was just horrible. Yeah.
Yes, our dogs and dogs have been through all that, and man, they suffered so much. The best way to clean a dog's teeth is to give him a nice chewy bone, and they'll get the plaque off, and good things will happen to their dental muscles and ligaments. They will get sturdy and strong. Not a bone they can break their teeth on, but a bone they can gnaw on and chew on. And the same for humans. So what are different natural ways to keep your teeth sturdy and strong? I'm going to ask for you guys' opinions. You've done a lot of different things that are natural and wonderful. Tell me about them.
I would think especially to eat things that require your teeth and your muscles and your tendons to work.
Yes.
To chew on something, to give them exercise, connections down to the bone, all that kind of stuff.
Absolutely. Work them. Use it or lose it. Eat foods that you got to chew, that require chewing. We live too much in a society of smoothies and everything is Vitamix. Not good. First, you don't have a chance to chew that food. When you chew something in your mouth, you're starting the digestive process. When you drink a smoothie, it's going straight into your alimentary canal. And I can understand giving a smoothie to a dead or dying man, but a healthy individual needs to chew their smoothie ingredients.
How do this juicing, which I know you recommended in certain cases for certain people, how does that work in this factor of teeth?
Juicing in cases of chronic disease, juicing in cases where you are missing the nutrients that you need to give your body the health that it needs. And eating 10 pounds of salad is not feasible for people who need the minerals that come from 10 pounds of salad, but may not have the teeth to eat that. And so it's a bit of a chicken and an egg. In order to have sturdy teeth, you need to have the nutrients. And in the early going, you may well need to get those nutrients exogenously until you're able to make them yourself from the food that you eat.
Got it.
Any other means to keep your teeth sturdy and strong?
Oil pulling.
Oil pulling. Excellent. That is the best plaque buster ever. It nourishes your gums, especially with animal fats. If you oil pull with animal fats, guess what you're getting?
Nutrition.
Anyone take a guess?
Well, nutrition as well as, yeah.
You're getting nutrition, you're getting fat-soluble vitamins, which are critical in growing enamel, in strengthening your teeth. Vitamin A, D, K, and E are critical to dental health. All right.
Would you say something more based on what Sunshine just said about oil pulling? What substances are best or worst for doing
Yes,
it?
yes. Any kinds of oils or fats that are not processed, that are preferably cold pressed, as cold pressed as you can get them, that contain a high amount of nutritional value, meaning they're not as processed. You just put them in your mouth. Most fats kind of melt in your mouth. Even coconut oil melts in your mouth, and you go swish, 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 swish until the lipases in your mouth have, and the enzymes in your mouth have emulsified that fat, and it turns to water. Then you spit it out. It
Right.
can be cold pressed olive oil. It can be cold pressed sesame oil. It can be cold pressed coconut oil. It can be cold pressed, or it can be low temperature cooked ghee, etc.
Can it be cream?
Hello?
Can
Yes.
you use cream?
Cream has more than fats. You can definitely eat cream, though. Raw cream is wonderful for your teeth. Absolutely wonderful.
But
Yes.
ghee is what you would say. to
Ghee
use.
is what I would say for an animal fat like that, because it's
Okay.
it doesn't have the proteins or the carbs left in it, or the water left in it anymore.
Mhm.
So what is, as someone's mentioned, I think Sunshine mentioned, that these are meridians. So your teeth are really circuit breakers for your body. Your teeth is where electrical charges move and are guided throughout your body. 101 electricity from your high school days. What does electricity do? It moves from a positive to a negative. It forces the so there's, if in a water you put one type of metal that acts as an anode and another metal that acts as the cathode, electricity moves from the positive to the negative, which forces the ions from the anode to go to the cathode, say a spoon or a tooth. So your tooth is like a spoon or a cathode. The anode is connected to the positive terminal of your body, and the cathode is connected to the negative terminal. And your saliva acts as the fluid in which this ion exchange occurs, and the purpose is multifold. It's not just, it's manyfold, excuse me. Number one, it is to mineralize your teeth. So if you cover your teeth with toothpaste and it's nice and smooth and wonderful and you think you're very healthy, the opposite, folks, because your teeth are covered with a coating that prohibits the mineralization of your teeth. You can expect teeth with pox on them if you don't have direct exposure to your saliva after you've washed your mouth. Your saliva is laying calcium, phosphorus, magnesium on your teeth and making your enamel strong, sturdy, and resistant to decay. So you want to let your teeth roll free in your saliva, and you make a ½ liter to 1.5 liters of saliva every day. Saliva is God's gift to mankind's mouth. Let it flow freely around your teeth.
So what about the metals that we use like in forks and spoons and so on? How does that affect it?
So you can feel it if you're I'm highly sensitive. I rarely use metals to eat. I use chopsticks or I use my fingers. When you put a spoon in your mouth, you are electricity, current is going to flow between the metal object and your teeth, right? And so, and you can feel it if you're pretty sensitive. I'm pretty sensitive. And so I use wooden spoons, wooden forks, wooden chopsticks. Mankind has used their fingers for millennia to taste their food, feel it. And that's sort of the first precept of ingesting your food. You feel it with your sense of touch. So I would encourage you to taste your salad with your hand, or if you have to eat with an instrument, try using wooden instruments, because saliva has a very critical role in remineralizing. And if you keep that saliva from your teeth, even for 3 or 4 hours a day, which you do, for people who are zealous about brushing, my dad used to be zealous about brushing his teeth actually, and he had a lot of dental problems. You're going to actually demineralize your teeth. the opposite of what you would think. The dentist is always handing out Colgate Total toothpaste, the anti-tartar control toothpaste. Can anyone guess what Colgate Total contains?
Fluoride.
Yeah, it contains fluoride. It contains glycerin, which keeps your teeth away from your saliva. It contains antibiotics, folks.
Ooh.
With every brushing, your mouth is getting completely denuded of antibiotics. You're swallowing it. So now you're eating antibiotics every day, twice a day, or however many times you brush your teeth, and you're greatly impairing your dental health. Colgate has got the American Dental Association sewn up. They will sell you all kinds of crap for big bucks through dentists that is very, very deleterious to your health.
Sushma, a dentist once told me, you know, so many people try to brush right after eating, thinking that that's what's to do. He said, rinse your mouth with water after eating and give yourself time, because if you brush right after eating, he said the enamel is softer from having chewed the food and gone through that whole biochemical process. And best thing is rinse with water afterwards.
Yes, absolutely, absolutely. And as a matter of fact, there's stuff in the food that the teeth will absorb. In the cud that you chew, in the salival cud, there are minerals that your enamel will absorb right up front. And so, you know, rinse a little bit afterwards, but you know, you don't have to have gobs of food in your mouth, but absolutely right. You don't need to brush your teeth after eating.
Yeah.
So I have another question related to this. I know because of the spacing of my teeth and a broken tooth top, that food accumulates between my teeth and at certain places that if I don't remove, it stays in my mouth. And it feels really good to be able to remove those bits and pieces of food.
Mhm.
Comments?
So, yeah, that's a very good question, and a lot of people have asked me. If you look at my teeth, there's my teeth, and I don't floss. The plaque kind of goes between the teeth a little bit and seals off the interdental spaces. And if it's good plaque, it's good stuff. From time to time, you can blow it off with, you know, a dental rinse that you make at home that's made from food ingredients. But by and large, if you let it be, food doesn't get stuck between your teeth unless the gap is big. And if the gap is big enough, then it'll kind of come out. So what you'll find after you stop flossing is over time, you don't quite have those between the tooth problems.
Okay.
And by all means, if you have a millimeter gap, I would say you can take it off with your tongue or rinse it out. It will rinse out. But try not to use harsh instruments to get the stuff out between your teeth that's annoying you.
I have a very tiny plastic device that I use to remove those pieces of food.
Mhm.
So it's not harsh as metal things would be, but it works satisfactorily for me to remove those little bits of pieces of food. Any comments?
Try rinsing your mouth after a meal, after a few minutes or an hour or so after a meal instead, and ignore it.
Okay.
A lot of times I find people almost have this sort of habit of picking until, and they feel like there's a problem there. And when that happens, you want to look at your dental health in general, not at what's stuck between your teeth, because most of the time with healthy, you should not even be thinking about your teeth and the fact that there's something between your teeth. You know, there might be some lint or piece of fiber stuck between, but other than that, by and large, once you have enough plaque between your teeth, which is it's like sacrilege to dentists who think plaque is a very bad thing, then you're not going to have those problems. Your teeth adapt. The spaces between your teeth will close if you don't keep opening them up with picks, toothpicks, and picks of various kinds. Your jaw actually adapts itself to the eating environment. So try not doing anything for a few weeks. You're not going to get dental caries if you're on a low carb diet. It'll sort itself out. You'll even forget that you're supposed to pick at it after lunch.
Okay, good, thank you.
Anyone have any other question on this very important ion exchange process between your teeth and saliva? And so what's happening here in your mouth in the absence of toothpaste, Listerine, what have you, all those tooth powders and potions and paste, is your saliva's pH level is maintained in a very fragile, delicate, and precise balance at between 7.1 and 7.5. It can be 6.5 if it's slightly acid from the acid foods you've eaten, but largely it's slightly alkaline. And what happens in that environment is your saliva acts as the solution that causes ions to be deposited on your teeth. So you want to encourage that. It's critical, and it's wonderful to see the results of this remineralization. Sorry. And so we come to the matter of dental sealants. It was one of the most foolish ideas ever espoused by any dentistry science or any kind of science ever to say that you should. It's like asking you to put a plastic bag over your head. Dental sealants. I know children who've had cavities, and the solution by the dentist is, guess what? Seal up those teeth, they won't have cavities. Guess what happens? Underneath those sealants, the teeth crumble, they die. And pretty soon, they're ripe game for root canals, implants, partial dentures, and so on and so forth.
So Shima, I've never heard until now the idea or the product dental sealants. That could be just my inexperience, but I've never heard of that.
Yes, because you've gone to a slightly more holistic dentist. There are dentists who often recommend for their patients a sort of a plastic shield over the teeth. And that's possibly one of the most dreadful and harmful things you could do to your teeth.
They recommended that to my husband because he was grinding his teeth, and I kind of kept putting him off and off, and then he kind of forgot about it, and then I think he got a mouth guard instead. So I would rather have something that you can take in and out than always have in there.
Yes.
It was totally standard fare among children for many, many years to have them sealed, ostensibly to help prevent, damage to their teeth in really young children.
Ostensibly, yes. The most vile invention of dentistry, dental sealants. And metals in the mouth. I never went to a dentist in my childhood or growing up. I don't know if my mom even knew about dentists. But when my children were growing up, I would get this card that would make me feel very guilty if I didn't take my children in to a dentist. The dentist would recommend, oh, they have an upper bite or a lower bite, put in this thing and that metal thing and that and the other for 16 months at a time. And sadly, I fell for it. It was it was the worst health decision probably that I made for my children's mouth, because they had braces that they did not need, advised by a doctor who was making some $2,000, $3,000, $4,000 per set of teeth, covered by insurance. So, no one, the insurance companies are paying for it. The patients are getting, addled out of their teeth. The dentists are making their pool extensions, and the patient is suffering long-term. These are poisonous metals that completely wreck the ion exchange in your teeth for long periods of time. If you must do it, at least put in these things, these contraptions that can be taken off at night, or your teeth have some time alone in the mouth with their saliva and nothing else.
So Shima, I got a further question on this. Is it possible, and I'm not talking about saying that God made a mistake, but is it possible that some teeth through, I don't know, improper eating or food or something like that, are crooked or misaligned or otherwise so-called imperfect.
Yes, yes. There are children who are born, especially people with Down syndrome, they find, they have narrow dental arches, or if the upper arch is very narrow because of malnutrition in the mom. And when they have expanded these dental arches, the pituitary gland, which is the master hormonal gland, sits right on top of the upper palate. And literally it has room to grow and expand. And these children show growth, development, mental acuity, and so on. But these are few and far between. What we have seen on a colossal scale is well, yes and no, because our nutrition has been very degenerate for a lot of decades as well. But what the effects of these things are is that you've got metal in your mouth. And so, and instead of expanding jaws, they're taking out wisdom teeth. So now you're losing 2 teeth. The shape of your jaw is more narrow, more misshapen. You're going to have more mental problems. There's less room for your pituitary gland. And while you're doing all this, there's no ion exchange happening, which means you get dental decay down the road, for which there's more treatments that are even more toxic to your whole body. So it's sad. It's sad that we should need these. It is sad that we should have these implanted in our mouth for long periods of time. The ideal would be to get it out as soon as possible, have in your mouth a removable appliances if you absolutely need it, and understand that the entire time that you got stuff in your mouth, you are impairing the remineralization of your teeth. So it's a risk-benefit analysis.
I have a question which is personal, but which may extend to other people in a general condition. I've heard from one person who's treating me that over, I guess, ages, decades at least, that people have gone to a softer diet, we've mentioned already, which have allowed the jaw to misalign the lower jaw with the upper, and that's a condition that can be improved, which will affect other nerve connections and so on. Do you have any comments on that?
Yes, improve your diet. Rather than change the shape of your jaw, try and incorporate chewing and biting into your mouth in a more natural way. Your jaw, I guarantee, will adapt to it. And it'll adapt in a far more natural way than a forced appliance that pushes your dental arch this way. And see, the reason your dental arch is the way it is because that's the most appropriate shape and position of the dental arch. You can affect change by expanding the muscles you have, by increasing the strength of the ligaments and tendons, by chewing and biting gradually, but understanding what you're doing and using that as a mechanism to strengthen your jaw.
Great.
The other thing I want to say is people with underbites and overbites do adapt. They do adapt. And unless there's something terrible going on, I would not interfere with the mechanism except to really change my diet, understand that I cannot live on a liquid diet and eat food, and slowly strengthen my teeth, jaws, gums, etc.
Wonderful, thank you.
I would also understand the source of some of this. A lot of it is stress as well. People grind their teeth in stress. They clench their jaws in stress. I've seen that happen, and boy, at work, people are stressed out and they go home, grind their teeth, and pretty soon they've a broken tooth from grinding. And that is tough. You got to address at a more emotional and stress level. All right, so your dental appliances are causing an interference in the ion exchange in your body. You have amalgam, gold and nickel, and all sorts of tin and all sorts of metals in your mouth, in your implant, in your appliances, in your cavities that have been filled that impair the mineralization of your teeth. You have to work extra hard to deal with all that. And autoimmunity is the result because you have foreign objects in your mouth, and your mouth is part of your body. So any dentist that tells you, oh, I can put plastic in your mouth or this or that in your mouth and it's not going to have an effect, lying. Autoimmunity is the result of anything foreign that is not natural to your body, whether it's a wire, whether it's a metal filling, whether it's an implant or a screw or a post or rubber or whatever. It's also going to impair the oral bacteria. The kind of bacteria that grow in your mouth are going to be metal-loving bacteria. They might be bacteria that try and eat, because your body is going to say, hey, foreign matter, I want you bugs to eat that. And so you might have a very different biome in your mouth than you otherwise would if you had no chemicals or no metals in your mouth. So there's research on this. Fixed orthodontic appliance therapy is typically for a year to 2 years. It causes increased levels of nickel, chromium, which are released into the saliva, and they cause not just damage to the mineralization process, they cause damage to your cellular DNA. They're genotoxic, they're cytotoxic. So moms who have a lot of metal in their mouth and have babies, tough passes. Mercury passes at 4 to 6 times a higher rate into the through the placental wall into the child. Why? Because the body is trying to detoxify into the placenta. So the kids come out the gate, the babies come out the gate, and they have this prize of toxicity, of autism, of developmental delays. Questions? All right. So there's 200 to 300, and if many of us have had mercury amalgams, I've had one mercury amalgam placed, so that was 200-300 micrograms of mercury. I hair tested my hair, and my amalgam was failing, and there was loads of mercury in my hair, so I promptly got it removed. It cost me $50, which was paid for by insurance, to put in that amalgam. It poisoned me for 30 years, and it took me $1,000 to remove it. So remember that calculus.
Were you aware of the so-called mercury poisoning during the 30 years?
No, because my immune system was strong. As I started growing older, I felt little things here and there. And I said, what's wrong with me? What's wrong with me? And you have to be aware of yourself and actually say, what's happening to me? And I tested my hair. It was very high in mercury. My amalgam was failing. I was ingesting mercury, and that was not good for me. Got rid of it, tested hair again, no more mercury, all is good. 1,200 micrograms of mercury per gram with amalgam, and gold. Gold fillings are frequently combined. They don't tell you that. They combine them with amalgam, which contains mercury. Gold is a noble metal cathode, and mercury is a less noble metal anode, and so the two together cause cross reaction and constant short circuits. And so these fillings actually serve as capacitors. They store electric charges, and so people who have a lot of metal in their mouth feel the buzz, the pressure, the headaches way more than people who don't, because oral currents are 1,000 times, folks. When you're short circuiting in your mouth, you have currents that are 1,000 times stronger than your nervous system currents in nanoamps. Sitting next to a device is going to cause more EMF being released. It's having mercury in your mouth is going to add to EMF sensitivity, or any metal in your mouth for that matter. Land.
You mentioned a few minutes ago the idea of testing your hair. Was that muscle testing or having hair analysis, or what specifically was it?
Oh, hair testing, as in we pull the roots of our hair, send it to the lab for analysis, and urine tests are wonderful for mercury analysis, for mercury that's been in your body for a long time. So I would recommend it for everybody, a hair and urine test. I think the hair test runs to $80 or something, and the urine test runs to $112. Your insurance should cover it, but I don't know if it does or not.
What I've read by investigating that, I was told, or what I read, was that the urine test is much more reliable. It's an indicator than is the hair test. Any comments on that?
Hair test is more current exposure, and P test, urinary porphyrin test, is old exposure. because
Okay.
mercury, lead, etc., don't like to hang out in your bloodstream. They quickly dissipate into your soft tissue. They're lipophilic. The organs are lipophilic, and they love fats. So they go into your fatty tissue, like your brain. You know, they go into your heart muscle, kidney muscle, into your organs.
Mm.
And they're taken out of those organs in these cages, which wrap these carefully because they're so very toxic, and you pee them out from time to time. And that's what the porphyrin test measures. How many cages of mercury? How many cages of whatever else? Lead.
Got it. Thank you.
All right. Dental professions die at a far higher rate than others. They have far more depression. They have far more disability for mental health. They have far more infertility. Twice the rate of women who work as dental assistants are constantly breathing in these fumes, mercury fumes, or other deadly chemicals. Twice the rate of infertility, miscarriages, birth defects, stillbirths, disturbed menstruation, bad stuff. No woman should be in the dental assistant. No woman of reproductive, actually, no one should be in the dental assistant role, but particularly women of reproductive age who intend to have children. Because you're passing all this mercury to the next generation. They say dentists inhale or take in anywhere from 50 to 4,000 micrograms of heavy metals daily. They have twice the rate of brain cancers in dentists, glioblastomas, brain, mercury in the brain. 20% of Canadian dentists are in disability for mental health, which is an extraordinarily high proportion of dentists because they never moved from amalgams to the next thing. And the American Dental Association spent decades litigating, fighting against any dentist who objected or protested the toxicity of the mercury. And so they got culled. After 5 years in practice, their IQ drops by 1 standard deviation compared to the population. And I have seen that in dentists, 10-year dentists, 20-year dentists, 30-year dentists, the quality of their children, their mental acuity, cancers, it's very real. And this is based on a sample size of 9,241 dentists, Canadian dentists. Very good research. Land?
I've read about heavy metal detoxification. I understand the idea of going to the source to be able to remove the source of what might be there. But does that have anything to do with, after you've removed your amalgams and replaced them, to having a process which would detox the body maybe at a more rapid rate than other?
Yes, and I would like to do a whole other presentation. I've already done one at some point, I think, on chelation.
Yes.
Super important to detoxify in a safe, judicious, slow, and effective manner.
Yes.
If this comes out of your body in a watershed, it's going to go right back. It's going to get absorbed right back into your organs, and the organs that were not damaged previously will now get damaged. Very good point.
Thank you.
So occupational mercury exposure, you got to watch out if you work in a chemical factory or manufacturing business. Please get your hair and pee tested from time to time. OSHA will support this.
Are there certain things that you should be testing for, or is it a general test? You say test for heavy metals or test for mercury or test for lead, or what do you do with that?
Heavy metal tests, heavy metal or toxic exposure tests. There's specific tests that test for a whole bunch of hydrocarbons, pesticides, this, that, and the other in your pee, in your hair. And if you suspect a particular exposure, you can go for those classes of chemicals.
Great, thank you.
By the way, there's a new rule from OSHA where OSHA, Occupational Safety and Hazard, what is that, organization of the government, where they said, if an employer forces you to take a COVID vaccine, an employee, and the employee gets sick from it or dies from it, then that's an occupational hazard, and the employers are required to report it. This is what they put out earlier, And they were under so much pressure that 2 months later, they reneged on that. And now the employers don't have to report any damage that happens to their employees from mandated COVID vaccines. So if you take COVID vaccines, if you develop blood clots, if you develop autoimmune disease, if you develop myocarditis, if you develop brain swelling, you're on your own. Be careful. And what's happening then as a result is employers are going to be far more ready to mandate these things, these toxins to their employees with no consequence on the disabilities that are produced afterwards. And this is the first time, never in the history of OSHA have they gone back on what are clearly the toxic effects of something that an employer mandates. Never before in the history of man. And that we're doing that with an experimental vaccine that is now being mandated by employers, willy-nilly to their employees. I thought I'd throw that out there. In the various COVID vaccines, there's a lot of different chemicals. There's the mRNA, there's aluminum hydroxide, there is something called SM102 or TM102, which is the fat adjuvant which wraps the mRNA nanoparticle, and that's extremely toxic, extremely toxic. I just had my first set of people who come to me for homeopathic remedies who were very sick after their first or their second Pfizer or Moderna vaccines, and I can tell you the effects have been disastrous in the people who got sick. Severe brain swelling, body pains, muscle pains. For some people, it was after the first one. For some, it was after the second one. This friend of mine who lives in Sebastopol had severe headaches, unrelenting for about 3-4 weeks. That is brain swelling, encephalopathy. And severe bone and muscle aches. I left a bottle, a water dose of Rus Toxicodendron 1M and Arnica 3C mixed together on her porch. She took it and she said within 20 minutes, the headache completely disappeared and 70% of her body pain reduced.
Wow.
So we're finding that a lot of people are being forced to take vaccines at work, in workplaces, by their employers, by peer pressure and so on. If they have exposure, if they have side effects, please make sure you can help them with food, homeopathy, etc.
Sushma, since you mentioned it, I just not too much of a divergence, but want to know with the anecdotal reports you're just giving us now, what percentage or what number, I'm not doubting any of the cases you're reporting, but is it like 1%, 5%, 30% of the total number of people who have gotten them and are not a proponent of the shot at all? I just want to know for facts, is there a certain percentage that you've experienced in your practice or in your work?
My daughter's friends, one of them for 3 days was paralyzed in bed. She could not get up. She's of reproductive age and she's trying for fertility treatments. She should not have fertility problems, but she's having fertility problems. 2 other friends had severe reactions. I think it was the Johnson & Johnson, was it Johnson & Johnson or the Moderna? One of them, one to the first shot, one to the second shot, to the point where they were bedridden for 3 days.
Wow.
I had one elderly person who was vaccinated 2 months ago and is only now coming out of it. And I'm pretty certain she would have died. She would have died because if you don't acknowledge the damage and you go to a hospital and they don't acknowledge it, they're not going to treat it with the right antidotes and the person's going to die. And so Moderna, there's a lot of blood clots, Pfizer as well. But Pfizer tends to be more encephalopathy. Moderna tends to be more cardiomyopathy, different types of reactions. In the VAERS database, there are now close to 5,000 deaths from COVID vaccines. And and it underreports, not by 1 to 100, but by 1 to 1,000. So I'm gonna say there have been 5 million deaths, at least, of which 5,000 have been reported. And the death from COVID itself is very, very minor in comparison. So take a look at the VAERS database. If you want, I can send you guys a link and see how people have died, especially if you already got the COVID and you took it. The younger set are getting these cytokine storms, which is a much exaggerated reaction. And so we're not testing for any of that. Everyone is getting it willy-nilly.
Right.
And now schools are requiring it, colleges.
For children, yes. That's deadly, deadly. And children are at no risk. Children get well in like half a day. They have no risk of death whatsoever. And we're putting an untested experimental vaccine on children. And in many states, they can go there without parental consent. They're giving them ice cream, $50, lotteries to lure them into these camps. It is just horrifying to witness.
Right.
All right. And let me tell you, I've had COVID. I am 62, almost 62. I was sick for about a week. It's like a bad flu. It's definitely not the plague. All right. How did we get distracted? Avoid daily sepsis. So what you want to do is avoid putting, someone had a question?
No.
Okay. Avoid putting pointy things into your mouths, which cause wounds in your mouth, which cause your oral bacteria to divert into your bloodstream. They're not welcome in your circulatory system. They are meant to be in your mouth. Your mouth has very different bacteria than your throat, which has very different bacteria than your stomach, which has very different bacteria than your small intestine or your large intestine. Your skin has very different bacteria also. So there's classes, phyla of bacteria that are resident on different parts of your body that serve very important functions, but you don't want to mix them up. If you want to have,
I have a question, just reading your text. It says even good bacteria are not welcome in your circulatory system. Can you say a bit more about that? I don't understand that.
Yes, your circulatory system does not have bacteria. So it's not supposed to have pathogens or either good, friendly or unfriendly bacteria in it. So if you had a lactobacillus in your mouth, that's wonderful for your mouth and your alimentary canal. You don't want it inside your bloodstream.
Okay.
Yeah, so the product of this, see this fermentation, the product of this fermentation should not cross your blood-brain barrier or your gut-blood barrier. Because your alimentary canal is a tube inside a tube inside a tube, each separated with a different ecosystem.
Thank you.
If you have plaque that's bothering you, or if you eat sugary things and you have this plaque that you feel is unhealthy, oil pull. That's a gentle way to avoid bleeding gums or Listerine and this and that. Just oil pull while you're taking a walk, when you're going out on chores and driving around, and brush gently with woody items if you can. You know, you have these neem sticks you could brush your teeth with. You could take a soft toothbrush to brush gently with, but not harsh. Not violent jets of water, steel picks, bleaches, surfactants, soaps, enamel, coaters, drugs. They're all present in your toothpaste. What is the best toothpaste, folks? Any ideas? Need your suggestions. Take a guess.
None.
None is a good idea. But if you had to put something in your mouth, brush it with, please use foods that you things that you would eat. Cinnamon powder, coconut oil, you could use baking soda, maybe some charcoal from time to time, but infrequently. By and large, you don't need to brush your teeth when you're eating a pretty good diet. Rinse debris after eating, but don't brush harshly. Your teeth are not gonna like it.
It's funny.
I have a question.
Yep.
What about water flossing?
Same thing.
Same
You're
thing as
using- yeah,
plastic.
same thing. It's a very high speed. These picks, water picks, very high speed. You're blowing through. You're making holes or spaces between your teeth, and sepsis is created as you have wounds. There's no need for this kind of harshness in your mouth. Your mouth is created to deal with the daily grind of eating food 3-4 times a day, and it handles it just fine. It just needs the right nutrition. If you have to water pick, if you have the kind of plaque where you have to water pick, you probably are eating too many sugars in your diet. I have almost no plaque. I eat a very high fat diet. I eat a lot of proteins. I eat, kale from my garden, and grow your own food. Grow your own food, super important. Even if it's one plant, grow it.
Mhm.
If you want to whiten yours for the more vain amongst us, you got to make a presentation, and your teeth got to look good. Use activated charcoal, use baking soda, but not every single day. From time to time, rinse your mouth out with it. Brush gently with it. That'll whiten your teeth, and it's safe.
Is there I'm not sure if the right term, but a natural color for teeth, or does it vary according to the individual?
It varies significantly by the individual, but put it this way, they can range from hues of yellow to very white, but that in no way, unless they're brown, sore, but they've got black marks on them, then the color will indicate bad health. But anything from a darkish yellow to white doesn't mean your teeth are in bad health. And because you have the teeth of a news anchor, beautiful and bright and pearly, made thus with bleaches, does not mean that you have good oral health or bodily health. In fact, they're very stressed out people most times and have very bad dental hygiene. Bleach for teeth works, but it'll poison you. It'll weaken your gums. It's imposing chemicals upon a live organ that you don't need. And so if you had to really blow the plaque out of your mouth, here's a trick. Don't do it often. Do it once in a while. Put in a spoonful of baking soda into your mouth, or half a spoon, and take a chug of apple cider vinegar. You will have an explosion in your mouth, but it'll clean your mouth good, your teeth good, naturally, without the aid of harsh chemicals.
That creates a lot of foam or a lot of explosive stuff. I've seen that. I felt that.
Yes, yes. And some people are scared of it. Don't worry, it's not going to harm you to do it in small quantities over a long period of time, after a long period of time. But if you needed the mouthwash, yeah, Maria?
Did I miss something? I know I stopped using toothpaste and I just use like a baking soda toothpaste.
Okay, it depends on what the ingredients are.
Yeah, but sodium bicarbonate, talc, acid, sodium, methyl. Yeah, there's a lot of stuff in there.
Yeah, ditch it.
So are we just using the brush? Are we using, so you're saying like, if I don't want to use toothpaste, if I still want to brush my teeth, do I just use regular baking soda every day or not?
I would make a wonderful toothpaste of either coconut oil or cold pressed sesame oil with a little bit of baking soda and some cinnamon or something added to it. It's absolutely delicious. And if you eat it afterwards, that's okay too.
Okay, so I would make my own toothpaste.
Yeah, would make your own toothpaste. But if it has all these multiple chemical names and ingredients, even if it says natural, ditch it.
Yeah.
So what does oil pulling do? See that difference between that plaque and this? Gentle oil pulling once every so often is going to clean out plaque that doesn't look good. It's not that you're getting cavities, but you might be drinking coffee, and so this will clean it out in a gentle way without any harsh chemicals. The oil pulling is also gonna plump out your cheeks, your wrinkles. You look beautiful if you oil pull. You'll notice that people will say you glow more. So rather than applying lotions and potions on your cheeks, The better way to apply lotions is to oil pull, and the oils float into your skin, and your skin absolutely glows. I've seen that in people, and it's wonderful to see the results.
Is it important to rinse it out after using, or can you swallow it, or is that one or the other better?
I would rinse it out. I would spit it out because it's got stuff that you didn't want. But
But
on
not-
occasion, I have swallowed it, and I didn't
But
have
not
a choice.
down the drain. Not
Oh,
down
what's
the,
that?
but if you spit it out into garbage, not into the drain.
Yes, yes. Although by then it's pretty emulsified.
Yeah.
All righty.
What
Um,
about using tallow for oil pulling?
Absolutely, if you
That's good.
can.
Okay.
Tallow might not melt in your mouth. Depends on what the oil or fat does at 98 degrees. If it melts, by all means use tallow. You can use bentonite. So how do you mineralize your teeth? In your saliva, in your mouth, you have substances that are rich in minerals. And that's where Lance, Terramine clay comes in, Redmond clay, bentonite, all sorts of clays were used historically to mineralize, and they have wonderful effects. The saliva picks up what it needs, the enamel picks up what it needs, and you're mineralized. You can give it to your dog. You can give your dog a little bit of oil, a little massage, gum massage. You can use salt in your, well, very finely ground, mixed in with a fat. So there's all sorts of natural ingredients you can use to brush and massage your teeth and gums gently.
What about seaweeds if it's ground real finely?
Oh yeah, yeah, do so. Seaweeds, hold it in a gel in your mouth, and you will mineralize your teeth with wonderful sea minerals.
Mhm.
It's an awesome idea. What a good idea.
Does it do the same thing if you use like Himalayan sea salt or some other salt? Does that work the same way, or do you need the oil for the pulling?
You can do both salt and oil, but so long as the salt doesn't scratch the surface of your teeth, you want to make sure there is not scratchy stuff in the, because your teeth, you don't want to scratch them. But experiment, be your own doctor, use substances that speak to you, and don't hesitate. Your doctor does not have the answers, you do. That's the point.
What is that purple matter there?
What's that?
The plant? It's not on the screen.
Oh, the plant is neem. The plant is neem. Neem is a medicinal plant from India. It's a tree actually in India. In the poor villages, they use neem sticks to brush their teeth. And it's just wonderful. Your teeth, it's kind of bitter, a little bit bitter, and sort of, it's wonderful. It feels good afterwards. And you get this gentle massage on your gums. So you can take a wooden stick of a tree or a plant that's medicinal and just rub it on gently on your teeth, and then when it softens up, the fibers rub on your gums, and you get a gum massage. Bleeding gums, receding gums, only diet, and only diet will fix them. Not surgery, not going to an orthodontist and getting all that done. Diet and only diet will fix these problems.
I have an experience of many, many years ago. I went to a dentist and he said, your gums are receding. If you'd come to me a month ago, I would say surgery is the only answer. So now I've changed. He said, he gave me certain vitamins to take, vitamin supplements. I think it was CE, and I can't remember what else. But the other thing was he suggested massaging the gums and using my finger or a tool that he had invented or something. And that supposedly helps the gums to regenerate. And when I went back another time, I said, please check my receding gums. And the hygienist said, you don't have any. They're not receding at all. They're just normal.
Yeah, absolutely. I mean, it's as simple as taking a finger and going, from time to time on your gums. Do it, guys. Explore your gums.
Yeah.
You'll strengthen them. And so the purpose of this is to look around you locally, what is available, what sort of fats are available locally, what sort of clays are available locally, what sort of ingredients are available locally to heal your mouth. You don't have to brush your teeth every day. You never have to brush your teeth in order to avoid cavities. It's all diet, what you put into your mouth, how you treat your mouth, and an absence of poisons in your body. And so
this is a great
basically-
stress.
Hmm?
Sorry. I'm going to say it's a great stress relieving episode because I think we've all felt guilty for not flossing and brushing all the time at times. So thank you.
Yes, yes. Don't ever feel stressed. Don't ever feel guilty about not visiting your dentist or doctor. Remember, it's their job to create a revenue stream out of your body. It's your job to create your health. And there's always going to be this tussle. Your teeth are part of your body, and what you want for your teeth is exactly what you want for your body. So these are foods that are rich in fat-soluble vitamins. Sugar cane, strangely enough, is rich in vitamin K. I used to eat that as a child. Cod liver oil, liver, butter from grass-fed cows, natto, the thing I was forgetting. All sorts of gooey cheeses are very rich in the vitamin Ks and delicious to boot. Eat them. Salad dressings that are rich in cold-pressed oils and apple cider vinegar are just wonderful for your teeth. Raw milk will mineralize teeth. Absolutely, I've seen miracles of mineralizing from drinking raw milk, raw cream, etc. So
Can you talk a little bit about tongue cleaning?
Oh yes, yes.
Tongue.
Yeah, you will notice that your tongue is not furry if you're not eating too many sweets, fruits, sugars, carbohydrates. Plain and simple. Your tongue will get furry if you have carbohydrate-rich foods and you're not utilizing that carbohydrate energy. Like if you're a child, you can burn off all the sugars you eat and donuts you eat, but as an adult, it's harder and harder, and what you develop is a furry tongue. If you use Colgate Total, I've noticed people will stop using the toothpaste and the furry tongue disappears. Why is that? Anyone take a guess why using Total gives you furry tongue after a while?
So chemicals in there which are probably poisoning your tongue, or what's seen on your tongue.
It contains triclosan, a very potent antibiotic that wipes out your bacteria and that leaves room for yeasts to grow in your mouth.
Mm.
That's what's happening in COVID infections today in India. When you go to a hospital in India with COVID, they give you massive doses of antibacterials, antivirals, and steroids. The antibacterials wipe out your gut bacteria. The virals, antivirals, wipe out your viruses. What's left? Fungi. And then they they suppress your immune system with steroids. And these people are getting something called mucomycin infections, which is fungal infections, and the death rate is 50%, 50. The death rate from COVID itself is less than 0.5%, and the death rate from mucormycosis is 50%. So watch out for classes of drugs that wipe out one kind of creature from your body. Anyone else have any contributions to the food list here?
One of the things that I just realized is I'm a little slow to this maybe, but the idea about how the body parts are all connected. They're not just here are the teeth, here's the tongue, here's the arm, here's the gut. It's all connected.
No man's an island. Yep. It is connected. We are connected. We're connected to our lands and animals. I am astounded by the amount of Roundup that my neighbors are putting in here. It's going into the groundwater, going into the well water, and poisoning all of us. We're so connected, and yet we feel that somehow we can sequester this poison and that poison, and it will not have an effect.
What about cloves?
Cloves are great. If you have tooth Inflammation, they're wonderful. They're mild anesthetic if you're coming out of some tooth problem. If you have a dental infection, garlic, chewing raw garlic will instantly stop the excruciating pain. If you have a chipped tooth or a broken tooth, I had one, I did not go to a dentist, hurt like hell. And the second I chewed on garlic, the pain would go away. The infection carried on for a few days. The chip had gone all the way up my tooth with something I bit down on the farmer's market. And over time, the tooth kind of cracked and fell off. And now I have the base of that tooth and nothing else. So it's a spacer that's keeping my other teeth from coming together. And I'm very happy. If in 62 years I lost one teeth, I'm cool with that. If I'd gone to a dentist, they would have said, oh, crown, then the crown would have eroded, oh, root canal eroded, oh, implant, and I would have had multiple sclerosis or Alzheimer's or Parkinson's. I know my system is too fragile to those kinds of insults to take that.
So Shema, one of the things that I'm considering, talking is the idea of removing a root canal that I do have in my mouth. I know that if a tooth is removed, it provides, before removal, a space between the other two teeth on its side. So if I remove it, there's going to be movement, lateral movement of those adjoining teeth.
Yes.
Do you have any guidelines for how to address that?
Yes. The first thing to remember is the pros and cons of one versus the other. Removal of the root canal, removal of potent chronic illness. So that's the first cost benefit analysis you need to do. So worst case, there's a massive space and all your teeth are all messed up and you can't bite anymore. And on the other side, you now have perfect health in other parts of your body. That's one. Number two, the situation is not so dire. You can put in a plastic spacer that just sort of sticks in there. You can put in a spacer at night only so that it stays there. Or you can choose to take out the spacer, and in the early going, you're going to have problems chewing and biting. But your body is miraculous. Your jaw is miraculous. It'll adapt. Your bodies have a way of adapting to things. My tooth was very painful. It was horrible because it's a molar. And I had a hard time chewing for a while until it hardened off. And so for a few months, you're going to have troubles. But that trouble is far superseded by the troubles you would have if the infections from the root canal spread to other parts of your body.
Thank you.
All righty. All right. Bad breath. Which actor had bad breath? Who remembers that? It was an old actor with bad breath, and the actresses would really, really be horrified about kissing him.
Clark Gable.
Yes.
Really?
And it cannot be fixed with peppermint. A bad breath cannot be fixed with peppermint. The antidote to bad breath, folks, is this: an enzyme-laden, bacteria-rich food. If you want to kiss your spouse, your other significant other with impunity, eat enzymes, eat proteins, decrease the carbohydrates or sugars, refined sugars in your diet. These are anti-inflammatory foods. These are pro-dental health foods. Kimchi, kefir, garlic, ginger, master tonic, hot peppers. They contain enzymes. They contain bugs. They help you digest your food. The bad, foul smells do not come out of your mouth unless your teeth are really decayed. They come from your belly. It's a sign of great ill health. And if you're having bad breath, change your diet. How do you tell a person who has bad breath that they need to reconsider their diet? Any thoughts?
So you could share information that you know or you have resources for.
You could do that. Most people, though, end up using Listerine. Most people end up brushing their teeth more than ever, more vigorously. They double down, and the bad breath gets worse and worse and worse. Bad breath masked by Listerine. Have you ever smelled that? Woo! That's horrible. And so it behooves you to educate people in diet and pass it on, guys, because if their gut is healed, a lot of other things will be healed too.
I have a question for you. If we were to ask you another question, is there anything that we have not asked or that you have not presented that would be a good thing to address?
Oh, I haven't gotten to the end of my presentation yet.
I wasn't sure where you were then.
Yes, yes. Let me get to the end, and then if I think of something, I'll tell you. You've already covered this. Do eat foods that help to form your jaw muscles, ligaments, and tendons, may strengthen your mouth area. It could be apples, it could be chewing on gnawing on a bone, it could be vegetables with deep, deep roots. Why vegetables with deep roots? Why perennials instead of annuals? Any guesses?
They're closer to the source of the nutrients in the soil.
Yes, and the deeper the root, the more nutrients it's getting. We are in the habit, folks, of eating annuals. Try and grow a perennial in your backyard, tree collards, ashitaba, perennial spinach. The roots of these plants go deep, 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 and they have a variety of wonderful nutrients and minerals in particular. Those tap roots and fibrous roots go very deep in. And the more of those you eat, the more delicious they are. Eat them with a lot of fats, and you'll find that you mineralize better.
And you'll satisfy the drought problem by getting deeper roots.
Yes, yes, for sure. Yes, for sure. You will not need vitamins and mineral supplements if you're eating some of these vegetables. Sea kale broccoli, things like Turkish rocket broccoli. These have 10 to 100 times more minerals than the annuals, which have shallow roots. And then you fertilize them with fake fertilizer. You're not really getting nutrition from salads if you eat those kinds of salads. So I would recommend, even if it's in a pot in your tiny backyard, grow something that's permanent and eat it, because you're tending to it. There's this whole aspect of the sun, the wind, fresh air, and deep roots.
What do you say to oxalates in spinach and kale?
Yes, yes. Some people are sensitive to oxalates, some people are not. The key to neutralize and metabolize oxalates is to cook it in a lot of fats, to ferment it, to slather it in fats and cook it, and it becomes more digestible. And there are leafy greens that are rich in oxalates and that are not so rich in oxalates. So you can pick and choose your vegetables if you're sensitive.
Thank you.
Sushma, I have a question that I know I've been listening to podcasts and all these things over the maybe recently, last months, years, about what to plant in your garden, what foods to eat, and you've given the guide about eating from deep down, and I've heard that. Would it be appropriate for you at some time to make a presentation about foods that are best for certain parts or health or conditions or times of the year, all that kind of stuff?
Yes, my general recommendation would be never till your garden. Never let the layer of soil be exposed to the elements, cover it up with mulch, and tend to get seeds that are permanent, that are perennials. And there's a company in France, a seed company called BT Seeds or something. They sell perennial seeds, and they have these wonderful, long-lasting plants that they're like trees that give off leaves that are absolutely delicious, that go deep in, that are very drought hardy, and that are delicious.
Would you say the name again of that company?
I think it's BT Seed Company in France, but I will put it up in Facebook. I will put their website up. It's in French, but I believe they have an English website as well.
Great, thank you. So my question, I'm going to repeat just a little bit what I just said, the question of making sure that you have a balanced, so-called balanced diet, but eating things that have maybe a dearth of it, have an effect on certain systems in the body. If you don't eat enough of this, or if you eat too much of that, this is some of the results.
Yes. You need, above everything, you need fats that are satiating. You need fats like the raw butter, that are rich with fat-soluble vitamins. you need these fat soluble vitamins to digest the minerals that you need to mineralize your teeth. And you don't digest them without the fats, without the fat soluble vitamins. So it's important to understand that any green, leafy green, needs to be combined with a fat in order to make it most assimilable. The key is not, you could get all these minerals, supposed minerals, through vitamin capsules that you just keep popping. You know what's going to happen? They're going to go in one end, come out the other. They find them in porta potties, completely undigested minerals. They're not getting assimilated into your body. The way to assimilate it is with fats.
Yeah.
So I would say the single most important ingredients to good dental health is actually fats.
Mm-hmm.
So I've got a couple of questions.
Mhm.
One is, can we perhaps even have a seed exchange? Because if you've been growing something that is, well established in your garden, it's producing seeds.
Yes.
And it would be wonderful if those of us that have that could share seeds with other people. And maybe we could see who's interested. My other question is, what about comfrey? I mean, comfrey, which is called bone knit.
Mhm.
How does that work with the teeth?
Comfrey is very good on bone fractures, on joints. It is good in smaller quantities in a mineral tea, but base it upon your digestion. See how you feel eating sauteed comfrey. The leaves need to be eaten at a very tender stage. Afterwards, they get kind of bony and fibrous. But yes, I've heard of a lot of people who do very well with comfrey, and it's so rich in minerals. Or put comfrey on your other edible plants, and those minerals will get into those plants.
Or borage, maybe even.
Yeah, borage, comfrey. I use borage flowers a lot. I don't use the leaves. Comfrey leaves I've used occasionally in soups, but not regularly. Sorrels I use a lot, high in oxalates, but it fights cancer. It's great. I used to add it to salads in small quantities. So everything is in balance. And if you put fats in it, that greatly ameliorates the bad effects of some of the phytonutrients, phytochemicals in plants.
Thank you.
And yes, I have kale seeds to share for anyone that wants my wonderful kale. It's like no kale you've ever eaten, folks. I did not like kale until I started growing my own. It's amazing. All right, so
another question, just to clarify for me. I understand your focus and emphasis on good fats and slathering fat on and all those kind of things. I want to know if, in addition to its intrinsic qualities, like of the butter, which I love, that you helped us find and get, is it something that's the process of transport of the other items that facilitates the minerals and vitamins being absorbed, in addition to the own qualities of the product itself? Or what is it that working?
Oh yeah, that's a very good question. So when you ingest a leafy green, a leaf, the plant doesn't want it to be eaten. The plant contains lectins and phytates that prevent that mineral from being digested by your body. And so animals will frequently have diarrhea if they eat certain foods, certain plants or leaves or grasses. And the reason is they chelate it out. It cannot be absorbed. On the other hand, when you treat that plant material in a certain way, then the minerals get grabbed by the fat, which contains the fat soluble molecule. They go to your gut barrier, and they get transported in a recognizable form into your bloodstream and wherever they're needed. And so the role of the fat soluble vitamins and fats is to transport minerals, to transport proteins into your body, which otherwise would not be digestible. That answer your question?
Wonderful, thank you. Very clear and helpful.
Okay. You want to avoid refined sugars, flours, oils. Guys, toss the oils out in your house. Don't use oils. Fat soluble vitamins are present in all the raw fats that you're eating. I hope you're eating abundantly of the raw butter. I am. I had 4 tablespoons of that almost this morning. And my eggs, I have it in everything. Oil pull regularly if you want to take away the coffee stains and such. Encourage healthy biofilms. Biofilms are God's gift to mankind. They are not horrific things that need to be ripped out of your mouth and treated with, harsh chemicals. Focus on remineralizing your teeth. Every culture has foods that are good for the teeth. Every locality has foods that are good for your teeth. Forage, find them, eat them with a lot of fats. But the key here is what is good for your body is good for your teeth. What is good for your teeth is good for your body. You cannot separate the two. If you have bad dental health, that means you have bad physical health. If your mouth is smelly, that is because you're not eating or your gut is not properly working. There are other deep biochemical problems in your body. So when you have a dental problem, it's like the canary in the coal mine. Teeth are the canary in the coal. You should be very concerned. You should be very concerned. And the good news is, even if you wreck your teeth today, 6 months from now, you can really, really fix your teeth. You can remineralize, you can take away the schmutz on your tongue. You don't even have to break, just a change in your diet, just changing the way you live. Because the teeth are very plastic. Anyone that tells you teeth don't fix themselves is lying, unless it's completely dead and gone. Do you have, I'm gonna have to go very fast through this, but this is basically what we've talked about already, which is your saliva, which is a magical, miraculous brew. You make about 1/2 liter to 1.5 liters of it every day. It's controlled by your autonomic nervous system. So the parasympathetic stimulation produces abundant quantities of saliva. What happens when you're in stress? Anyone have cotton mouth? That's what happens. Your body focuses all its energy on running away from the problem or facing that fear. Your mouth goes dry, you don't make saliva. If that happens enough times, you're gonna have rotten teeth. So it's important to understand that your saliva is just a wonderful, wonderful salt-laden, protein-laden, hormone-laden, sacred nutrient that you want to feed with your actions, really. If you are open-mouthed when you are sleeping at night, you get something called xerostomia, which is get mouth breathing, dry mouth, and you don't want that. So that is, again, not a dental problem. That is a gut problem, a body health problem. If you're frightened, the saliva gets thickened, viscous. My Roxy, our dog, when she gets stressed out or very overheated, she has frothy saliva or viscous saliva. And that is sympathetic stimulation. And you want to avoid that. You want to avoid situations that get you into that kind of saliva. Radiotherapy and chemotherapy will destroy. So people who've had any kind of cancer treatment have terrible teeth. What does that mean? That means they have terrible health. They don't have terrible teeth, they have terrible health, because those are a metric or a sign of far, far deeper fundamental problems.
I've noticed that if I concentrate or think of delicious food that either I've had or about to have, I sense an increased amount of saliva in my mouth.
Yeah. It's funny. I was watching a video of a person who was making a breakfast. She was a vegan type person, and she was making breakfast from everything she found in her garden. And she put 1/2 teaspoon of coconut oil in it. And I could literally feel my belly saying, more butter, please. It's not going to taste good. Because I do that exact same thing. When I think of good foods, I start salivating. Saliva contains precious enzymes. So you want to have saliva when you're eating your food. All digestion, the amylases, lysosomes, mucus are the first phase of digestion. If you have any digestive disorder, you want to focus on eating a good meal, sitting down very mindfully and thinking about your food. To be specific, the saliva has almost 102 proteins, 35 of which are salivary proteins exclusively, 67 serum proteins to nourish your gums, to nourish your enamel, electrolytes to lay minerals on your teeth, hormones, guys, antibodies to fight pathogens in your mouth. And so all sorts of testing is done on saliva because it is the canary in your coal mine. You can tell if you're pregnant from your saliva. You can tell if you're stressed from your salivary test. You can tell about cholesterol levels and cancer from markers in your saliva. So it is a wonderful thing that you want to nourish with good food and due care. It has defensive and buffering capacity, your saliva does. And the three buffer systems are the bicarbonate, phosphate, and the protein. And what these buffer systems are doing is maintaining the pH of the saliva in a very specific range, 6 to 6.5 to about 7.5, more towards alkaline. And what that is doing is when it is oversaturated, when it's oversaturated with calcium, say hydroxyapatite, that'll prevent dental demineralization. So if there's enough minerals, then the enamel will have minerals on it. If there's not enough minerals, it'll actually denude the minerals. There's a salivary protein pellicle that protects your teeth against irritants, poisons. Humans are always have historically digested poisons. How do we know what is good and bad for us? We eat poisons, and there needs to be protection early on to help defray the effects of that poison. It restores your soft tissue, so your gums. You're going to massage your gums, and when you massage them, you're massaging them with your saliva in your finger. It has mucins, which lubricate your mouth structure. So it's a primary precursor to all digestion. It has antimicrobial capacity. It has lysozyme, which kills bacteria, pathogenic bacteria. It has antibacterial lactoferrin, an enzyme which is antifungal and antiviral. It has peroxidase, so it's like a big antibiotic in and of itself, but it's smart. It lets in the good bacteria. It keeps out the pathogens. It has something called the salivary epidermal growth factors, so which enhances the speed of the oral mucosal lining, and it protects your esophagus, esophageal mucosa. And what ruins your saliva? Antidepressants destroy it. Antipsychotics will destroy it. Antihistamines will destroy it. Antiemetics, the vomiting drugs. Antiretroviral therapy, the protease inhibitors will destroy your, cause xerostomia. Decongestants, appetite suppressants, diuretics, irradiation, chemotherapy, viral infections, uncontrolled diabetes. These are all Alzheimer's. So the diseases and chemicals, this chemical cocktail will destroy your saliva, and this is the first step in the destruction of health. All that's going to lead to dry chapped lips, desiccated, dry, fissured tongue, tongue diseases, all sorts of candidiasis, dental caries, gingivitis, and so on. So it behooves you to keep your saliva in good order, because once again, your teeth are you. They're part of your body. And this is a picture that Westany Price, the most wonderful dentist and the most honest and ethical dentist born at the turn of the century, last century, took of people on the cusp of civilization, of the effects of modern commerce. Look at their dental arches, guys. Take a look at this first guy. Look at that beautiful curve. It's not narrow. He's got nostrils he can breathe through. He's got a wide dental arch. Look at that mugshot. Look at how beautiful it is. He has no breathing problems. He has no tuberculosis. His digestion is good. Huge, huge difference between these and the sort of narrow faces we see in today's children. Of course, we're going to have problems. So for the pregnant amongst us, are you still here? Probably not. But if you are, lot of butter, lot of cream, lot of egg yolks, lot of fat soluble vitamins that'll give your baby these kind of teeth.
So Shimon, going back just a step when you're talking about saliva, you give a long list of elements that could affect or otherwise injure the production of the saliva. And I've mentioned, I thought of a couple myself, but what can be done other than, or in addition to good food that can encourage the development of saliva?
Oh, other than good, are you asking me or you had suggestions?
No, my question is in addition to good food, or is maybe
Oh, yes.
that
I could
encompasses
say-
a lot, but what else can we do other than, like I said, thinking of good food?
Inclined bed therapy. Incline your bed so you don't snore. If you don't snore, you don't have an open mouth. You don't have an open mouth, you have good saliva.
Okay.
Exercise well. Eat a lot of fats. It is a myth to say drink more water to have more water. Drinking more water actually dehydrates you. Eating more fats hydrates you. Why? Because in your body, 1 molecule of fat turns into 10 molecules of water in the metabolism. And so runners in particular need to run on a ketogenic energy base. And that's going to prevent death in runners. It's going to prevent them from overhydrating and being waterlogged and mineral deficient and saliva deficient. So I would say eat lots of fats, incline your bed, sleep well, address body issues, and mainly proteins need to be a good portion of your diet. You want to give preeminence to fats. Go out of your way to seek out good fats. Drive 50 miles to get a good fat because it is medicine.
Speaking,
All right, any questions?
yes, speaking of good fats, Mr. Weismel said that you had introduced butter to him, a good source of butter. Could you do that for the rest of us that missed that opportunity?
Absolutely. And is this Faye?
Yes.
Hi, Faye. Welcome. Yes, I absolutely will. Email me and I'll put you on next year's butter list. You have to be a local. We're located in California. Where are you located?
California.
Oh, perfect. All right. You can be on next year's butter run.
Thank you. Thank you. And regarding saliva, isn't eating less, having long intervals between food and being more hungry creates salivation, and doesn't that help with the saliva?
Yes and no. I think eating to satiation is a good thing. Some people do well on eating 1 meal a day. Some people do well on eating 4 meals a day. Depends on time of life, gender, your chronic state of your chronic issues, and so on. So I would say it would depend.
Thank you.
All right, and I am going to stop recording. Thank you very much. Thank you everybody for just all your wonderful questions, and I hope this is helpful.
And thank you.
Thank you,
Very much.
Sushma.
Thank you so much. Thank you very